Thank you, Judy. Ali Hassan is an 8-year-old boy from Pakistan. Born into an impoverished family, Ali was forced to do kitchen work for pocket change. Until one day on his way home, he was struck by a car. Thankfully, he survived the accident, but not uninjured. And in a nation where 3/4 of the population is uninsured, where out-of-pocket medical expenses often drive the sick into irreversible poverty, that Ali Hassan could have his fractured leg repaired seemed all but impossible. And it would have been if it wasn't for our next Innovation Award winner. Since she left medical school with 16 gold medals, and I'm pretty sure that's twice as many as Michael Phelps had at the last Olympics, a record which remains unbroken, Sania Nishtar has had one life goal, which is captured in the dedication of one of her books. And I quote, "To end the silent and unjustified suffering of millions of individuals for whom the right to health remains unrealized, and whose lives I strive and aspire to touch." And she has. As a renowned leader in health policy in her native Pakistan, a leading voice in the global health community, and a prolific author, Dr. Nishtar's advocacy focuses on a holistic vision of health that promotes the well-being not only of individuals, but also of communities and the nation. Her work to promote peace and a broader governance reform is part and parcel of her healthcare advocacy. To that end, she's the founder and president of Heartfile, an NGO that finds the synergies between the private and public sectors and sees how they can align in new ways to broaden access to healthcare financing and critically needed healthcare services. This kind of thought leadership in revolutionizing what are called mixed health systems has been the hallmark of Dr. Nishtar's career. It led her to found Pakistan's Health Policy Forum. It's the subject of her new book, Choked Pipes, which calls for a radical overhaul of Pakistan's poorly performing health systems and charts a pathway to reform. And Dr. Nishtar's bold thinking has helped to save lives. To give you a specific example, her organization is using existing mobile technology in a really innovative way. Thanks to Sania's efforts, doctors can verify a patient's poverty status, streamline philanthropic donations, and get people like Ali Hassan the life-changing and life-saving medical care they need. And with Heartfile, they can do it in 72 hours. Headlines were made earlier this year when the Pakistan Medical Association released its annual report, and it noted the dreadful statistic that a child in Pakistan dies every minute of every day from preventable diseases, and that 400,000 infants die each year before they reach their first birthday. Many organizations and individuals are working to save lives in Pakistan, but we recognize Dr. Nishtar this evening, not only for her many specific contributions to this cause, not only for her impact on individual lives, but for the innovative ways she has brought together people, organizations, and technology to reform an entire nation's healthcare industry. One of Dr. Nishtar's colleagues has described her as an extraordinary ambassador for her country. And so tonight, as we celebrate her work to transform Pakistan's health system, we also look forward to her vision and how it might extend to the rest of the world. Please join me in congratulating and welcoming to the podium our next Innovation Award recipient, Dr. Sania Nishtar.